everybody, I'm Azadeen Barakat. I'm one of the doctors currently working in the NHS in the FY2 standalone program, and this is my playlist on tips and interpersonal skills needed to pass Plab 2 exam. I have been doing Plab 2 mocks throughout this year, and I noticed many common mistakes that the candidates do in a repeated manner, and that's why I decided to make this videos so that most of the people benefit from it. If you haven't seen my previous videos, check them. They have a lot of valuable information. If you like my content, subscribe to my channel, and let's jump into today's video. Before we start, I just want to let you know that I just had my foundation program certificate of completion, and I'm about to finish my FY2 standalone year. I will make a separate video on this program, how to get accepted in it and how to get the certificate. The application window will open in January, so stay tuned to this video. Today, I will start talking about the management. So this will be the first of many videos on the management alone due to its importance. Today, we'll talk about some tips, and the rest of tips will be in the following videos. The number one tip in the management part of the station is to make it patient-centered. This may seem easy to say, but it is not as easy to do. And when I say patient-centered, I mean making the patient decide for their own treatment options. And this is very important, especially in the stations which have many options like conservative management, medical management, surgical management. It's not our job to impose our ideas or our opinions on the patient. Our job is to explain everything, the pros and cons of every option, and let the patient choose what best suits them. Some patients will always refuse surgical options, even if you believe it's the best thing for them. Some patients may refuse any tablets. They don't believe in medications for whatever reasons they have. Your job is to try to discover their concern, to answer their questions, but at the end of the day, it's not your job to decide for them. Explain everything to them and let them choose what best suits them, their beliefs, and their lifestyle. The second tip is about giving lifestyle advice. And in this part, I'll talk about two things: the way to give the lifestyle advice and the timing to give lifestyle advice. The wrong way to give lifestyle advice is that to ignore everything that the patient told you about their lifestyle and give them the lifestyle advice as it is. For example, if a patient had busy lifestyles so that they don't have time to do exercise, they don't have time to eat healthy food or cook for themselves, the wrong way to say the lifestyle advice is to tell them you need to walk 30 minutes every day for 5 days of the week, and you need to eat healthy diet. There is nothing medically wrong in this. You are providing the patient with correct medical advice, but the way will make the patient feel that you are not listening to them and you are not aware of their lifestyle and their circumstances. A much better way to give lifestyle advice is to make it tailored to the patient's lifestyle. This word is very important. Tailored means you give the patient the lifestyle advice in a way which is easier for them to follow. You implement it and make it included in the patient's day, in the patient lifestyle. For example, if a patient cannot do exercise and you believe exercise is important, cornerstone in their management, for example, if they are having angina and you are dealing with the risk factors and you need to give lifestyle advice, it's very nice to figure out how they go to their work. If they are taking the bus, you can suggest that they drop one station earlier and walk the rest of the way to their work, or if they drive to their place of work, to park a little bit far than their place of work and walk the rest of the distance. This is just an example. You can apply it to anything. The idea behind it is that you make it easier for the patient to follow and you are making it included in their day, in their lifestyle, in their timetable, it will make the patient as well the examiner feel that you were listening to the patient. This was about the way of giving lifestyle advice. What about the timing? And this is as important as the way. There are many times where the lifestyle advice wouldn't be appropriate. For example, if the patient is presenting as emergency, if the patient is having a chest pain now, and we are still in the process of diagnosing them, they may be having an MI, they may be waiting some bloods, they may go to the cath lab after a few hours from now, it's very irrelevant, very inappropriate to tell the patient, by the way, you need to stop smoking. Another example is when you tell the patient the test result and they figure out that they had cancer of whatever origin, let's say lung cancer, and you tell them you need to stop smoking. First of all, this will not reverse anything, so this is not an appropriate advice. And second thing, it's not the proper timing. This is an overwhelming news to the patient. The patient needs to absorb this news, to understand it, to ask many questions in their mind. They are not ready to change anything in their lifestyle at the moment. So you should put this in your mind before you give lifestyle advice to the patient. Ask yourself first, will it benefit them in this phase of their illness? And if yes, is it the proper timing to tell them this lifestyle advice? The third tip about the management is about the safety netting. Think twice before finishing any Plab 2 station before giving proper safety netting to the patient. There is a common mistake in the safety netting that it is generic, meaning it's not targeted towards the patient's real symptoms or the real fears that you have in mind or real complications that the patient may develop. If a patient came to you complaining of low mood and you made your diagnosis of depression, it's not relevant to give them safety netting advice about headache, fever, and chest pain. It's more reasonable and it will make more sense if you gave them advice about suicide. Tell them what to do exactly if they had any suicidal thoughts in their mind. This way, you are a safe doctor, you care about the patient's safety in the matter that is really of concern to you. Another mistake is that the safety netting should be about the next step in the management. If the patient is yet to go home, for example, in the young patients who had head traumas and you are advising the mother to stay 4 or 6 hours under observation, the safety netting here should be about this 4 or 6 hours, not after going home, because that's the next step in the management. And that's exactly why you want the child and his or her mother to stay longer in the hospital. We are waiting to watch for specific symptoms. We need to advise the mother about these specific symptoms in case any of them happened to tell the doctors. So it's much better and makes more sense to advise the mother about the symptoms of fits, confusion, and vomiting if they happened in the following 6 hours, to tell us, rather than if you went home and this happened, what to do. We are not yet in this stage. So those were 3 tips in the management part of the station, and there are more tips in the next videos about the management. If you like my content, if you find it beneficial to you, please subscribe to my channel to get the rest of my videos and put a like on this video so that I know it was of benefit to you. Stay tuned for my next videos and good luck with your preparation.